I am Dr. Julie Steinauer, and in this edition or segment of Ask Dr. Julie, we've got a question that, I'm going to be honest, I hear this one all the time, but today I just decided to kind of be the one asking it. Why on earth do we see all kinds of crazy asymmetry in lens prescriptions for kids and ourselves? Why does that happen? And this comes up periodically. I cannot put it back to any one specific person that comes in from our website or through email or for a patient or from someone on YouTube, which we get questions, just hundreds of questions every week, it seems like. But this one is really more something in my doing because I really want to talk about this topic. There are a couple of reasons why we start to develop asymmetry. So one of the things that you want to look for in either yourself or your kids is really be careful and aware of the fact that if they're watching TV, are they laying on their side when they watch TV? If they lay in bed at night and read a book, or you are, if you're playing on your phone and you're laying at an angle and playing with something or reading something from an angle, one eye is having to focus harder in order to see that material. It will cause an asymmetry in lens prescription. So again, so far we've got laying down watching TV, we've got laying down or somehow sitting at an angle with playing on a phone or tablet or computer or reading in bed. Another one would be multiple TV screens, and another one is in the classroom, multiple screens set up like smart screens, dry erase boards, and maybe old traditional chalkboards. So all of those things cause us to have to focus at a different area, and if I'm looking off to the side, then one eye focuses different than the other eye that has to focus. And so it could cause some asymmetry, but I bet this is one you haven't even thought about because it's not one I thought about either. What about for women and or kids who are carrying purses or backpacks? Now, this is an interesting one because if we're tending to create some structural changes on one side of the body over the other because we sling a purse over the shoulder or a backpack on one side, and we kind of tend to hunch and go down and back or something, then we're actually, as we're walking around, causing one eye to focus differently. That can be a reason why we develop asymmetry in our glasses or contact lens prescription. And I bet you didn't think about it, but it's definitely something that you want to think about for certain. I, as a doctor, do not ever like to prescribe glasses that are asymmetric, so I'm always trying to make them symmetrical, because as doctors, as soon as we start prescribing for that asymmetry, it's going to go like a brush fire in a dry forest. Out of control. So we don't want to do that. We want to try to keep them as symmetrical as possible. And so these are some things that you just want to think about. Watch your kids, watch yourself. If you happen to have that set up with multiple screens everywhere, then be careful and cognizant of that. You might not want to do that. All right, so pay attention to our quick tips and questions kinds of segments that we put out on a regular basis now that hopefully you're getting an email and liking. If you haven't, subscribe to our YouTube channel. And if this is you, you're like, oh my gosh, my lens prescription's like a -2 and a -4. What can I do about that? Is it too late? Or maybe it's your child, right? So contact us, 618-288-1489, or you can go to our website, fill out a questionnaire, the quality of life questionnaire on the front page there at visionforlifeworks.com, and then we can get back to you. But if you're local, I just encourage you, just pick up the telephone. That's the easiest, fastest way to get to us and give us a call. Thank you.